Hey there, welcome back to Medifit Mosaic. Today we are going to explore one of the most crucial topics for managing your health, how type 2 diabetes is diagnosed. Type 2 diabetes is a condition that often goes unnoticed in early stages because its symptoms can be subtle or even absent. But don't be fooled, early detection is absolutely critical. It gives you the opportunity to take control of your health, make important lifestyle changes, and prevent serious complications down the road. In this video, we will break down the essential tests and procedures used to diagnose type 2 diabetes, giving you a complete understanding of how these tests work and why they matter. Let us dive in. Before we dive into the specific test, let us talk about why early diagnosis matters so much. Type 2 diabetes doesn't just suddenly appear overnight. It is a condition that develops gradually, often over the course of years. Many people are living with elevated blood sugar levels without even realizing it, because the early symptoms can be so mild. However, even when you doesn't feel it, high blood sugar can cause significant damage to your body. Imagine this: elevated blood sugar levels are slowly working away at your blood vessels, your nerves, and your vital organs like your kidneys and heart. Left unchecked, type 2 diabetes can lead to serious complications such as heart disease, kidney damage, nerve damage, and even vision loss. But here is the good news: by catching it early, you have the power to slow down or even prevent these complications. Early diagnosis allows you to start treatment, make lifestyle adjustments, and protect your body from long-term damage. Now let us get into the key test that healthcare providers use to diagnose type 2 diabetes. Diagnosing diabetes isn't just one test. It is about getting a complete picture of how your body is handling glucose over time. The main tests used include the fasting blood sugar test, the HbA1c test, and the oral glucose tolerance test. Each of these tests give doctor different insights into your body's ability to manage blood sugar, and depending on your symptoms, family history, or risk factors, your doctor may use one or combination of these tests to give you precise diagnosis. Let us break down each of these tests down and understand exactly how they work. First up is the fasting blood glucose test, a simple yet highly effective test used to check how your body manages blood sugar levels after a period of fasting. This test measures your blood sugar levels after you have fasted for at least 8 hours, typically overnight. Fasting allows your doctor to see how your body regulates blood sugar without the immediate influence of food. Here is how it works. After you fast, your doctor will take a blood sample to measure the concentration of glucose in your bloodstream. This gives us a clear picture of how much sugar is circulating in your blood when you haven't eaten for a while, which is an important indicator of how well your body is maintaining stable blood sugar levels. Here is how the results from a fasting blood sugar test are interpreted. Normal below 100 mg per dl, pre-diabetes between 100 to 125 mg per dl, diabetes 126 mg per dl or higher on 2 separate occasions. This test is often one of the first steps in diagnosing diabetes because it is both simple and effective at identifying pre-diabetes or diabetes. By catching elevated blood sugars early, you and your doctor can take action to prevent further progression. Now let us talk about the HbA1c test, also known as the A1C test or the glycolated hemoglobin test. This is a powerful diagnostic tool because unlike other blood sugar tests that give you a snapshot of your blood sugar at a single point of time, the HbA1c test tells you what your average blood sugar levels have been over the past 2 to 3 months. So how does this test work? When sugar enters your bloodstream, it binds to hemoglobin, the protein in your red blood cells that carries oxygen throughout your body. The HbA1c test measures the percentage of hemoglobin that has glucose attached to it. Since red blood cells live for about 3 months, This test gives us long-term view of your blood sugar control. Here is how the HbA1c test results are interpreted. Normal below 5.7%, pre-diabetes between 5.7% and 6.4%, diabetes 6.5% or higher on 2 separate tests. The beauty of the HbA1c test is that it doesn't require fasting, making it super convenient. Plus, it provides a much more comprehensive picture of your blood sugar control over time compared to just a single test. The American Diabetes Association ADA recommends the HbA1c test for diabetes diagnosis because it is both accurate and easy to administer. However, it is important to know that tests can sometimes be less reliable in certain circumstances, such as during pregnancy, individuals with anemia, or for people from certain ethnic backgrounds. In those cases, your doctor may rely on additional tests to ensure an accurate diagnosis. Another key diagnosis test is the oral glucose tolerance test (OGTT), which is often used to diagnose gestational diabetes during pregnancy, but it is also helpful in diagnosing type 2 diabetes in certain cases. This test is a bit more detailed because it measures how your body processes glucose over a specific period of time. Here is how it works. After you have fasted for at least 8 hours, you will drink a sugary solution that contains 75 grams of glucose. Your doctor will then monitor your blood sugar levels at specific intervals, usually 2 hours after drinking the solution, to see how your body responds to this glucose load. Here is how the OGTT results are categorized. Normal before 140 mg per dl, pre-diabetes between 140 to 199 mg per dl, diabetes 200 mg per dl or higher. OGTT test is highly accurate because it measures how well your body handles a glucose challenge, making it especially useful in cases where other tests don't provide enough information. While it is a bit more time consuming than other tests, it provides valuable insight into your body's ability to manage blood sugar. The random blood glucose test is another option that doctors use when immediate evaluation is needed, especially when someone is experiencing symptoms like excessive thirst, frequent urination, or unexplained weight loss. Unlike other tests, this one doesn't require fasting or preparation, which makes it ideal for emergency situations. This test measures your blood sugar at any time of the day, regardless of when you last ate. If your blood sugar level is 200 mg per dl or higher, you are experiencing symptoms of diabetes. It is a strong indicator of diabetes. The random blood sugar test is often used in urgent settings or when there is a strong suspicion of undiagnosed diabetes. It is quick, effective, and gives doctor an immediate snapshot of your blood sugar levels. There you have it. By understanding these key diagnostic tests like the fasting blood sugar test, the HbA1c test, and the oral glucose tolerance test, and the random blood sugar test, you can be proactive in identifying and managing type 2 diabetes. Remember, early detection is the key to preventing serious complications and living a healthier, more active life. Thank you so much for watching. If you found this video helpful, make sure to like, subscribe, and hit the bell icon so you never miss out on our health tips and guides. Share this video with anyone you know who could benefit from learning more about diabetes testing. Stay informed, stay healthy, and I will see you in the next video.